Welcome to the Technical Assistance Network for Children's Behavioral Health, Cultural and Linguistic Competence Peer Learning Exchange. The Peer Learning Exchange is a monthly call or webinar with topics focusing on culture, health equity, and disparities in children's behavioral health. Topics are generated by you, individuals working in or being served by behavioral health organizations and partnering with systems of care, states, and communities. The TA Network, as it's known, is the National Training and Technical Assistance Center for Children's Behavioral Health for the Substance Abuse and Mental Health Services Administration, otherwise known as SAMHSA. For today's topic, community-based support, natural helpers, community health workers, and peer support workers, I'm joined by Miriam Monsalve-Serna, President of the Center for Community Learning in Miami, Florida. The Center for Community Learning is focused on providing training, technical assistance, research, and program evaluation on issues affecting diverse and traditionally underserved communities. Miriam is a licensed clinician with an extensive background in working in underserved communities to build capacity for leaders seeking to work effectively with service systems on behalf of their fellow residents in particular. Much of her work has also focused on organizational development and leadership. My name is Linda Callejas. I'm a faculty member at the University of South Florida and the co-director of the Cultural and Linguistic Competence Hub of the TA Network. I'm an anthropologist by training with research and evaluation experience in the areas of collaborative community development, behavioral health disparities, and health equity. And I've also had the pleasure of working with Miriam and others in examining the work of natural helpers, community health workers, and peer support workers in behavioral health, generally defined. I'll be starting off the presentation, and Miriam will jump in with me, adding her valuable expertise throughout. This presentation is being recorded, and your lines will be muted for the first part of the presentation to help eliminate background noise. So feel free to use the chat box to type in any questions or comments during the presentation. We will do a brief presentation, but hope that will generate enough discussion to take us to the 2 o'clock hour. And following that initial presentation, we'll open up the lines for further questions and discussion. The TA Network will make the slides that we're going to present available to you at the end of this webinar within the presentation box, sorry. So if you are able to join us till the end, you'll be able to access those. We also want to make a quick plug for our next month's webinar, Peer Learning Exchange, which will be held on August 4th at 1 p.m. And it's going to focus on the class standards. So look for details in the TA Telegram. Thanks all for joining us. And let's, without further ado, get started. Miriam, I just wanted to make sure that you're on and
yes.
You're able to hear me? Okay, perfect.
Yes, good morning. Good morning, everybody. Yes.
Thanks. So just very quickly, we're going to start with a brief overview of what we're talking about when we talk about community-based support and the type of workers that we reference in the title. And then we'll lead into some important workforce issues, and hopefully the discussion will center around some of the challenges many of us may have faced, as well as strategies for success and opportunities when working, providing this type of support in our communities. So what do we mean when we're talking about community-based support? In this slide, what we're hoping to convey, it's not the best the best image, but when we look at behavioral health services organizations and their efforts to try to reach out to underserved communities, what we know traditionally as racial or ethnic minorities, but other underserved communities, LGBTQ, folks that tend to have difficulty accessing behavioral health services in particular, one of the key interventions that has gained a lot of recognition is this community-based support, which we may have heard be referenced as natural helpers, community health workers, peer support workers, and those types of workers often serve as a bridge between the organizations and systems within which we work and the populations we're hoping to reach. Now, we put, if you can see there, the double-sided arrow to try to convey that while there is an element of outreach on the part of these workers, there's also a change that comes back to the organizations as they begin to learn more about the populations that they're trying to serve. Because the community-based support workers, as we'll see in some of the next slides, come from the communities that we're seeking to reach. And they can help organizations better understand where they may be having gaps or difficulties in reaching out and increasing the availability of services that they provide, as well as accessibility to those services. And also understanding what else they may need to do in terms of creating or bringing on board new interventions that can address the needs of the populations that, that are constantly changing. And we're ringing around this, this image, that community context. That lets us know that there are issues such as funding and policies that behavioral health organizations and systems have to deal with as they seek to try to address the needs of diverse populations, right? So that context constantly changes and may even change the populations that organizations have to focus on. And so in that changing environment, these community-based support workers can help to get us a picture of the changing landscape, so to speak, on what communities are facing, how their needs are changing, where we may be falling down with regards to improving access and ensuring that folks are using the services that we have available for them. Okay. So very quickly, we wanted to also show that this type of work in communities has a fairly long history, if we think about it very broadly, with regards to natural helpers and community health workers in particular. We know that for those of us working in systems of care, we have heard about peer support workers, and that's a growing area of interest for many of us, for providers as well as policymakers. But the work of community-based support workers, such as natural helpers, and especially community health workers, it goes back to at least the 1960s, if not further, in this country, where we have workers, health workers in particular, now we're talking about physical health, going out to Native American communities along the U.S.-Mexico border, immigrant communities known as colonias, where there has been minimal infrastructure and a very high rate of need for a variety of services, including behavioral health services. So this idea of this type of worker being able to be identified from among natural leaders within a particular population, that looks like the population that's being served, that understands the history and the context of that community, and can provide those of us in the provider realm or in the systems realm with a better understanding of how folks are approaching services, if at all, and what we can do to better engage with them. So natural helpers are go ahead, Miriam.
Yeah, no, what I want to add is that many years ago, when SAMHSA introduced the grants about the system of care, the concept of natural helpers was used, for instance, in Seattle. And that's where I knew for my first time that was the natural helpers that we were using. And later on, of course, we knew about the promotoras. But in the United States, as far as I remember, it was based on the SANSA grants from many years ago.
Right. Exactly. So there is there's a history of this work being done in communities successfully. And one of the things we'll see, as in the next slide, is that there are a few names out there, a lot of names actually, and we put them using the slide that you see on the screen now in sort of a continuum to try to highlight some of the similarities and differences. And as we'll see as we talk more about the workforce issues and maybe some of the challenges, one of the things that is important, I think, is to have a definition of the type of worker or person that we're talking about, and then understanding that role. So natural helpers we see on the left side, where we look at folks understanding that natural helpers are folks from within the community identified as leaders and typically are hubs already within their network. So they may be individuals that folks in their community come to because they happen to know, have been through a particular situation that caused them to engage with a service system. And because of that experience, they are able to help their fellow residents in a time of need. And in a lot of communities, we have individuals that we know are leaders and that are identified as such, and that they're a go-to person for information, for where do I go if I need to do this. And that may be someone that isn't necessarily formally working with a service system, but they can be, right? And they don't necessarily need to be just someone in the neighborhood. If you look at the literature, the research literature on natural helpers, they may be folks in our workplace, in our agencies, that just sort of work in that capacity just because they tend to have that knowledge and willingness to do so. Now we move to the community health worker, because that's more of a, if we look at some of the work that community health workers have done in the literature, some of the work that Miriam and I have done, and Kathy Lazier, who co-directs the CLC area for the TA network, we see that natural helpers sometimes are folks, if we keep to that identification as someone from within the community, a natural leader, so to speak, then can be trained and further trained to work in a more formal capacity as a community health worker. Community health workers, obviously, as their name suggests, have a lot to do with physical health, and many of us may have experience with them in terms of organizations that deploy them to work in the areas of diabetes, tuberculosis, heart disease, etc. Very similar. There are folks that are from the community, have been identified already as leaders, that have connections in the community and are able to then go back after training and do education, popular education, outreach, extensive outreach, and also help to inform the organizations and change, in some cases, the way they work in order to better accommodate the needs of the populations being served. And finally, we put the peer support workers at the end to show that this is a new emerging role within behavioral health in particular, and that's focusing specifically on the importance of the lived experience as expertise, so that those folks come with knowledge of the service systems in particular, and usually are in recovery or have a child in recovery, and so are better able to advocate for families and children and youth in the system, in various behavioral health service systems in particular. Miriam, did you want to add anything here? Okay, so we wanted to also give some very specific examples of work that we've done in various communities. So the first example of natural helpers that we have is the Equipo model that was developed by folks at USF, the University of South Florida, including Kathy Wazier. And Miriam was one of the original and trainers that has worked around the country distributing this model. The model was developed to support partnerships and increase the understanding on the part of providers of natural helpers, and again, how to work together to increase access to services, to behavioral health services.
And I want to add something interesting about Equipo, because Equipo really was developed based on the need for the former providers being able to work with the natural helpers or informal providers. Because for some of the former providers, case managers, psychologists, etc., they didn't have the opportunity to work with people from the community. So that's, we saw that need. And this Equipo training was developed where we have natural helpers, community health workers with the formal providers, and they can appreciate what the others have to offer, both ways. And the community health workers, the natural helpers, can appreciate what the formal providers have to offer. And the formal providers can appreciate how well the natural helpers are linked to their communities and the credibility that the natural helpers have within their community.
Right, exactly. And I think this is one of the few models and trainings that actually really focuses on that area, and that is like really important when we start to think about some of the challenges and opportunities down the line in terms of helping, you know, the organizations make some of the changes in their infrastructure in order to better incorporate natural helpers, community health workers, and peer support workers. I just noticed in the chat that folks were having trouble hearing me, so I'm hoping that this is working. So next, an example of community health workers where we deployed the Promotoras model also at USF to develop services. What we did with the Raíces Promotoras project was to adapt existing wraparound teams at elementary schools and have them work with a promotora from the community that was identified in South Hillsborough County, Florida. That part of the county was very rural and agricultural at the time, without very high rates. We're talking rates of over 85% Latino Spanish-speaking families, and many of them migrant workers who, when their children had issues, especially in the school with severe emotional disturbance and other behavioral and emotional issues, were not able to access services either through those teams or just in general what was available in the county, much of it due to not just the language barriers but the cultural barriers. And so the idea was to use this Promotoras model, and Promotora is the community health worker in Spanish, to work with the team and to help those teams understand, those wraparound teams, to understand the needs of the child and the family, to be able to advocate on behalf of that child and family more explicitly, and to help the school understand. So some of the ways in which the schools that were deploying these teams changed was to increase, services, or having bilingual persons at the front desk, which some of them didn't have, and to actively make some of those changes that they needed to in order to help those families not just engage with behavioral health services for their children, but also with the schools themselves. And the promotoras were very much a part of getting that done. So that started with a small project with 2 schools and eventually expanded to 5 different schools in a wider area of the county. And the final example that we show again are the peer support workers, which many of you probably have examples of working with or having experience with within your communities. These types of workers, as we'll see, are also called from different names, including peer navigators, peer specialists, and they provide support and assistance based again on their experience. As I said, that's like the main thing is having that experience of having lived through not just the service system navigation, but really being in recovery and being able to speak to what it takes to maintain your recovery over time. So it's a combination of those 2 things. And we know that this is a role that is very much being highlighted in systems of care communities as well as in child welfare systems across the country. And we see a number of peer support workers working among youth in various communities around the country. So this is an area of great growth, and I'm hoping that at the end when we have discussion that maybe there are some peer support workers that can talk about their experience thus far in the systems of care and communities. Miriam, did you have anything you wanted to add before we move forward?
No. I think that you covered, because we can talk about opportunities and challenges about the peer support workers at the end of the conversation. Yeah.
Okay, perfect. So when we're talking about identifying potential workers, and recruiting those workers, as we said, one of the key things is looking to the communities or the populations that we're actively trying to reach. So that means for agencies, for organizations and systems, and that takes some change on their part usually, because sometimes when we're hiring, we have our go-to networks and areas. We'll post a position here or there. But if we think about some of the populations that we're trying to reach and the fact that they may not be getting to us, we may need to do a bit more thinking ahead of time before we just sort of post in some places a position or an announcement for a job. We really need to start thinking about the available budget, obviously. Do we have the funding to cover the cost of this worker? We do know that, in the literature and the experience that we've had on this, those of us on this call, some of these folks work as volunteers, right? And that's possibly a way to kind of have an on-ramp to start. But typically this work is very involved, it's very time intensive, and it's just out there in the community with a lot of engagement with direct service engagement in the community. And so you have to, as an organization, begin to not just think about the budget, salaries for these folks, and then really think about what it is that they'll be doing in your organization and whether your organization's infrastructure supports the work of this type of worker. Because, as I said, if they're out in the community all the time, they may not be able to, if you have an agency where everyone's in the office and you have a typical 8 to 5 day and that's what you're expecting, that may not be the environment where you are going to feel comfortable having this type of worker, right? So those types of expectations and outlining how you are going to manage all of this needs to be done up front, thinking through with the leadership how this person's going to work. And then really clearly establishing, go ahead.
I want to add something about this piece. That is, as you mentioned, some of them, they are volunteers. And some of them, they are volunteers because they want community hours. especially in places where we have issues with documentation and immigration. Some of them, they want volunteer hours just in case the laws change related to immigration. Some of them have the motivation of training. Many immigrants, they come here because they want to be better off, but also to receive training. So the fact that we are offering training, and that training is free, and the training also, we have different levels, up to the certification for the community health workers and the peers. That's another of the incentives for some people get engaged in the workforce, although they are not employees. One thing that is very important when we, and this is related to the budget, when we are starting to recruit the people from the community that are linked families or youth with services, is the amount of money in food, because some families, an incentive for some families to attend the group of families is to have a nice warm food during the evening, as well as, if they are not employees, to have the opportunity to have in the budget some stipends to recognize the time they have spent serving the families.
Yes, definitely important. And when thinking about, volunteers, that they are volunteers, but there also is going to be an actual reason for having them in your organization, and you want this to be a clear-cut strategy that you're employing with mindfulness. The other thing that I wanted to highlight, besides these important points that Miriam just made, is the real importance of establishing the clear hiring criteria and the job description to really understand not just that you're going to hire, say, a natural helper, a community health worker, or a peer support worker, but really to develop that job description to be specific about how they will interact with your other staff, how they are going to receive ongoing training and coaching, and we'll talk a little bit more about training on the next slide, and also how they fit in the system. And as we'll see, as we'll touch on some of these issues in just a little bit, you can't expect them to, these workers, to change the system, right? We have to also, on our part, those of us that are working in the systems or systems representative, work with them in order to change things to better increase access to services for the populations that we serve. So in terms of training, what we've seen in the literature, and based on some of our, our collective experience, we have some core competencies that we recommend that folks that are interested in hiring and keeping on these types of workers, particularly peer support workers in systems of care communities, to really get trained in. And one of the things we see, if we're hiring from within the community and we're thinking about establishing the criteria for hiring, for instance, what is the level of education are we looking for? Are we going to prioritize education and work experience over actual lived experience and experience within service systems and recovery? Those are things that have to be worked out. And that's also going to inform how much you're going to allot for in your budget for salaries, et cetera, right? But in terms of training, we want to make sure that, and this is training obviously that would benefit all workers within system of care communities, but we really want to focus on emphasizing the importance of having core competencies, understanding cultural diversity. The fact that you come from a particular community gives you insights, definitely, but doesn't necessarily mean that you're an expert in working with diverse populations or in understanding diversity within your own population and how community changes and what you're comfortable with, quite frankly, with regards to how you do things and how others do. We also recommend, formal training and understanding resources and how to make referrals, how to conduct outreach and advocacy. Group presentation is really important and was important for, in particular, with the Raíces Promotoras project, where there was a lot of community-based education and but also with wraparound teams where you have to facilitate a family team meeting, for instance. And, there are folks that aren't comfortable with that level of public speaking, and so there should be a mindfulness of, preparing folks to do that. We also recommend and emphasize the importance of communication skills, and empathetic and supportive communication where listening is done and trying to build, in an effort to build rapport and empathy and supporting folks where they are, understanding that, that the communities that you are maybe working with may have experiences of trauma and other past issues that may make it difficult to communicate what may seem like to you effectively, but that should be handled in particular ways. And especially confidentiality and ethics with regard to training is another important area for folks that are, being sought after within a given population. Sometimes we find that maybe families may be a little leery of that because they may know this person outside of work, for instance, and so it's important to make sure that that confidentiality and ethics and privacy are all very much emphasized in training and something that's given ongoing priority through coaching. And after the training, one of the things that in the next slide, I kind of just moved on because we have some of the same things highlighted. But one of the key things that I would say here is that it's of utmost importance to think of training as something that is ongoing and not just a one-time event for your community support workers, especially folks that may not have an extensive work experience background or, even a BA or high school diploma. You're going to need to provide ongoing coaching and supervision. And there is a literature, especially with community health workers, that shows the importance of doing that and how much it means to the growth of the professional development of those workers. Miriam, did you want to say anything?
No, I want
the training
to see, in general, the success is when these natural helpers, community health workers, or peers, they have their own container that is through the coaching and the support. Because we all, as people, we have issues and problems and challenges. And many peer support workers and community people, they also have them. So they need to have somebody that on a regular basis, once a week or once a month, they can talk about their own issues and how they are dealing with the family. Because that has made a big difference in the communities that they have this kind of coaching and support versus the communities that let the peers or community health workers be by themselves.
Oops, sorry, I was on mute. Right, definitely. That's definitely important. And even thinking about training and ongoing coaching and supervision will require, I think, on the part of agencies to be very sort of listen and observe carefully when you see certain things, especially with regards to, say, boundary issues and or even having, you know, the lack of work experience and how that may or may not shape what you're seeing as a supervisor, say. Those are things that need to be you know, addressed in a way that's mindful of the population that you're recruiting, and also understanding that you may need to invest in sending folks to get up to speed on typing, on computer skills, on some of the things that we often take for granted when we work in agencies, and that those are areas that if we take some time and some funds to support those areas, we are, in essence, building our own capacity as an agency to better serve the diverse populations. And finally, just some words about evaluation. It's really, I think, important to, whenever possible, to try to evaluate the work of these types of workers in your system and your communities. And it's really, whenever possible, if you have the opportunity to, you know, partner with folks that have research and evaluation experience and that can perhaps, you know, help you do that. Maybe if they have funding on their end, we know that a lot of times services aren't funded to include a heavy evaluation load. But it's important because we know that there is this heavy emphasis, as we said at the outset, on the work of natural helpers, CHWs, and peer support workers. But the literature in particular on peer support workers is still developing. And we want to know, you know, if we think about this type of work, this type of support as an intervention that helps systems and organizations make better engage with communities. We want to know how well that intervention works, what particular aspects of it works, and if there's something that's not working, how do we change it to make it better? And so these are some of the things that you know, program implementers can talk about with their evaluators or partners in the community that might be able to help them provide them with some expertise in this area designed to get better information on how well the work of these types of this type of support is doing. Right, and one of the things I want to emphasize is that last point is that it's really important when you're doing this type of evaluation that because this is such community-based work, that you want to really get the voice of the individuals that are receiving this intervention, as it were. Okay, so if Miriam, if you don't have anything, we'll just move right into sort of the discussion phase. And what we're hoping is that we can unmute the lines at this point. We wanted to just start some of the discussion on some challenges that you or, you know, folks in your community may have faced with regards to working with one or more of these types of workers. So what are some of the challenges that you may have faced? And if you haven't particularly, what are some challenges, for instance, that providers or organizations might encounter when they're bringing on board a community-based support worker, such as a peer support? So the lines are now unmuted. You're all welcome to jump right in, or you can continue to use the chat. And I'll just give a minute, see if anyone wants to jump in. Miriam, do you have an example that you want to share?
Yeah. Yes. One of the challenges that I have found is that sometimes the providers are not ready to engage with community workers, and they don't see them as equals. There are many providers that belong to the culture that if you don't have letters after your name, you don't have enough knowledge. And what we have learned is that the people from the community, they really have the knowledge of the experience, and they really know the community. So sometimes, as I mentioned before, this is why we did the equipo training, because it's very important that you see your community health worker or your peer as an equal in the relation.
Yes, I agree. I've seen that as well. And I think especially with regards to younger peers, and there is an effort in many communities around the country in child welfare and behavioral health, mental health, to include youth peers, to work with youth. And, that can sometimes be a challenge where, especially in this when talking about a peer support worker, right, that's a youth that has been through the service system, sometimes it can be difficult for providers to really kind of go out on that limb and understand that this person, too, is a provider, is a direct service provider, and is someone that we have to engage with in that way.
Yeah. Also, another challenge that I have seen is the role, the job description is not clear. Especially volunteers and peers, they want to do meaningful work. And sometimes we find that they are doing tasks that they are not appropriate for a peer or a community health worker. So it's that you mentioned the importance of having really good job descriptions.
What would be an example, Miriam, of a
for instance, I have seen community health workers and doing in community centers, like they delivering the food, serving the food for the participants, and doing photocopies, and doing a lot of things that really, of course, sometimes you need to do some photocopies, but not as your role to be like an assistant of the center, or doing tasks that are not in your job description. So I have seen examples that really people get like, this is, I really want to help people because I have a lot of experience and serving food. I can do that in McDonald's and they pay me. Yeah, so that's one example.
Yeah. One other interesting challenge that I found when I was working with the RICES project is that, and this is kind of like the flip side of that coin, is that when families were initially engaged through the promotora, and typically they were all female, so it was promotora, there was a bit of a disconnect in terms of the idea that you as a parent have an expertise about your child that you should share with the provider, or especially the professional like a therapist or a doctor. And that was a sort of a cultural belief about the position of a doctor or psychiatrist or psychologist, and how much you question that professional. And so that was another area where it wasn't necessarily expected on the part of the promotora, but it was something that they had to help the family kind of understand that the service system in this country, that is perfectly okay and actually something that you should do most of the time. And so that was another area where it wasn't necessarily a challenge for the agency, but it kind of presented a challenge. It was a little confounding at first for the actual workers. So does anyone want to share with us is there anyone on the line? If you can just raise your hand if you don't feel comfortable talking, but that is using one of these forms of community-based support within your community. So one of the things we wanted to try to do is try to elicit some strategies that folks have been using around the country to better support the work of, peer support workers and others. Trying to see. Okay, so we're getting some chat. So Eric is about to start a peer support work in their community. And so have you all thought about any strategies, going beyond some of the initial recommendations about really clearly thinking through your recruitment strategy and your job descriptions and your hiring, about what you think may help to increase the likelihood that this type of work will be successful in your community? So while we wait on the chat, Miriam, do you have any strategies that you can think of off the top of your head that have worked in your experience in the past?
Yeah, we usually the way that we recruit is offering training or recreational activities for families and for youth, and they will come for those activities, and sooner or later we will see the leadership skills and the support skills that they have with their peers, and we start the training. That's a very important piece, is the training that we offer, as well as for some states the peer certification that is like a workforce development for them. And another thing that sometimes is a challenge is we train a lot of peers and we keep training them, but because they are so good, they move very fast to be care coordinators. So it's good, but at the same time we say, oh, but what happened with this and the other? And they always tell us, no, now he or she is a care coordinator, and that's also a motivation for some of them.
Yes, definitely. And I mean, while, as you said, it's a great problem to have, it also gives us the, sort of that tip that we have to, if we're successful, then we're developing a workforce that can move through our system and grow within our organization and our systems, and so that this is an area that we could continuously be recruiting for, and that the more successful we are at doing that, then ideally it's a win-win for everybody, because it can then generate more work in community. We did get some responses. We got, I'm just going to read them out. We got a message from Selena Webster Bass. I've worked with parent partners and think it's important to acknowledge the lived experiences of parent partners and to maximize that experience, to be a bridge between the team and the behavioral health care system, most definitely. I think that the lived experience part is a, especially for peers, for that peer support worker where the experience is key, that that when we say that we're going to include this type of worker, we really honor that experience as a form of expertise, and that helps us to be more responsive in the end. When we talk about cultural responsiveness, going beyond, sort of some of the identity, for instance, categories, we're really thinking about how folks respond to mental illness and other behavioral health issues and how they respond to recovery, and therefore makes us a little bit more responsive, right? And Eric responded as well that at the moment their community is focusing on helping one or two groups of youth and others in my organization on hiring and budget issues, and mostly working directly with the youth. And I think that this is a really important area for growth, the area of youth peers in particular. And when we think about certification, which is something that we really didn't talk about in the presentation, but we know that various states have certification and there's national certifications, that the work of peers, of youth peers in particular, is an area of challenge with a lot of opportunities for success, given the knowledge that our youth have and those that go on to really work as peers and excel in that area, the motivation they have given their experience and their expertise, and the importance of honoring that expertise despite what we may see before us in terms of a young person or someone that may not, that we may think is not necessarily old enough to work with us on an even playing field. So most definitely. Trying to think of other strategies for success
One piece that is important for some of the providers to know, and is related to the peer certification, is that in some states you can bill Medicaid for the services rendered by the family peers or the youth peers. So that's a consideration for sustainability, that in your plan of sustainability, providers should take into consideration.
Yes, very important as well. Very important in terms of getting that work funded. And so we move to the final slide on opportunities. And so how, we're interested in learning more about how communities identified opportunities for implementing, say, a peer support component in the organization, or having the parent partners work with you. And how, how this came about. Those are the things that we're interested in learning more about, is how you came to the realization that this would be something important for your community to do. Did you base that on, your demographic information, your knowledge of the community, your utilization data? These are, partly because I'm a researcher, but these are ways to use the data, right, to have us understand what's going on in our communities. But also we get some of this information from the folks that are receiving services or are contacting us to understand the services we provide. So that's another question that we'd like to throw out there. We did get one more response that I'd like to read, and I apologize if it seems a little bit off where we're reading the responses and the questions are a little bit past, but I think it's all touching on some of the same issues. So Selena responded back, one of the issues we face was making sure parent partners address self-care. Yes, that's critical. And helping them find balance in managing their paraprofessional roles and their own lives with youth facing behavioral health challenges. Most definitely. Most definitely.
Yes, that's very important, and that's part of the what I call the space through coaching and mentoring them, so to make sure that they take care of themselves. In some communities, they request that the peers have what is called the RAP, that is Wellness Recovery Action Plan, as one of the requirements to be a peer. So they will have a plan on how to take care of themselves and how to take care of the triggers that they can encounter when they have a youth and they share similarities in their life experience. Hello?
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 Can you hear me?
Yeah.
Okay,
Yes.
sorry about that. What I was saying is that in a project that I'm working on with child welfare involved peers, one of the things that we've seen is not only that the individuals that are working as peers have child welfare experience, they also have substance use disorder issues that they're in recovery from, and that we've seen as they work with families, sometimes they are triggered in terms of they can be, upset by some of the situations that they've seen and that they see in the course of their work, and it affects obviously not just their work but themselves as individuals and their ability to be able to continue working. And so it's an area that we definitely think is critical for those of us hiring and working in agencies with these type of workers to keep in mind. So Eric has added, we looked at stats on the school system graduation rates, drug use problems, poverty levels, and realized that peer support lived experience model could be more successful than the current models being used to help our youth. Great using data. Yeah, thank you. We're coming on, actually, we've got about 3 minutes left, so I'm going to go ahead and read the last chat. I think this has been a great topic, and I'm really happy about the participation. The final comment we have from Selena is we implemented parent partners as part of our wraparound care coordination. It's a critical component, and we reviewed our youth risk behavior survey data. So again, that highlights the importance of data, working with data and using data to really inform how you shape your service delivery. So just as a final note, again, the presentation was recorded, and we are going to, the TA Network makes available the recording. As we conclude now, they will make the slides available to you. You'll be able to download them directly through this portal. And we encourage you to join us next month on August 4th, once again at 1 p.m. for our peer learning exchange call. Thank you all.
Yeah. Also, I want to add that we have resources, that you have access to resources, and to the TA network constantly. We are adding new resources. So here we have some resources in your PowerPoint that will give you good examples of how has been implemented in other places.
Thanks. Thank you, Miriam. Thank you, everyone, for joining us. We look forward to talking with you again.
Okay.